Hi, everyone. My name is Dr. Logan Lynch. I'm a pelvic floor physical therapist, and I'm here to talk to you about return to fitness postpartum. I work with clients every day who either are early on postpartum or gave birth years ago and have a lack of information and guidance and education about how to return to fitness postpartum. And I won't even say safely because I don't really like using the term safe because it creates a lot of fear around exercise, but I'll say efficiently and in the most optimal way, meaning the most optimal for your pelvic floor, for your body to not have pain or symptoms, not only just immediately postpartum, but also years down the road. Because I'm treating clients who, again, gave birth years ago, and I'm teaching them things that they were never told, never taught, never worked on, never focused on. And years later, they're having tons of leakage and back pain and all these issues that could have been solved earlier on if they were sent to pelvic floor physical therapy. And I don't blame anybody for not going if they didn't have that information. And I don't even blame providers. It's been an evolving area that we know more and more evidence about. And, that is the way that we're going, where I believe that every single person who gives birth should be sent to pelvic floor physical therapy, at least for an assessment. And then it's, from there to work with your therapist and decide if that's something that you want to continue with and the benefits of it. So what I want to provide you with today is some education, some guidance, some things to think about, and some tips about how to return to your fitness routine after having a baby, regardless of type of delivery. And because everyone is going to be different. So these are general concepts on just things to consider and things to think about so that you're not just given the only advice of at 6 weeks you have your checkup and then you jump back into your fitness and then we have all these issues, which is typically the route that we go, is told you have 6 weeks, you're all clear, and then you go right back to your fitness class and you're like, things are different now. What do I do? That is what I want to help you with. Now, I know that there is so much eagerness to get back to exercise after having a baby for a lot of people, especially if that is something that is a part of your routine, it's your community. And I think that's something that's not always acknowledged in the healthcare world, is like this advice is given out of like, oh, stop lifting weights, or make sure you don't lift over this, or, wait 6 months before going back to your fitness classes, or whatever that general advice is. And those providers are not acknowledging it's not just about the physical aspect. It's not just about, this person wanting to lose weight or get their body back or bounce back. It's about their support system. It's about their community, your fitness, your gym, fam, it's your like mental health support. It's your emotional support. It's your people that you want to get back to. So I think it's important to get back to those things as early as you feel comfortable, as early as you want to, but with just having some considerations in mind, again, so that you can be there and be a part of that community, but also honor the healing process of your body. I think there is a way to bring those two together so that you can get back and have all those social aspects, have that community aspect, but also do it in a way, again, that supports your body and that you feel really confident and empowered doing that, and also honoring that it takes a progression back into things to do it in the most efficient way. So the three concepts I want to talk about are restoring in the pelvic floor general health and function, talking about the gradual progression and mobility, as well as core activation and breathing, and how all of this ties into your exercise routine. So the first point, restoring pelvic floor function, okay? Whether you had a vaginal birth or a C-section, your pelvic floor has been affected. You were carrying a baby, right? So that is already putting extra load on your pelvic floor through that entire pregnancy, and your pelvic floor is going to react to those changes. It's going to have changes in the load that it was carrying. So maybe there's more tension through there to try and combat that. Or a vaginal birth, there's more stretch to those muscles. And the first thing that we want to do is really just restore optimal function of those pelvic floor muscles, especially from a coordination aspect. We want to tune back into those muscles and know what they are doing. Can they relax? Can they contract? Can they control our bladder and bowels? How do they feel when we breathe? What are they doing when we breathe? So one of the first things that I'm often having my clients do is, and we'll get to breathwork a little bit later, but is feel those muscles. Like do a Kegel. What does that feel like? Can you feel them contract? Is that hard to do? How is your strength? How is your control? Does it feel strong? Does it feel like it flickers a little bit? Do you find yourself pushing down when you try and contract? Like, what is happening at your pelvic floor? And that is something that can be safe to do very early on, of just like creating that awareness of those muscles, doing a contraction, but also the relaxation, getting that elasticity and that length back. And a lot of people think that it's just automatically a weak pelvic floor is the issue, but there's so much involved. It's the coordination, it's how it's reacting, it's the anticipatory function of those muscles when you cough and when you sneeze and jump. So we want to restore that. We want to feel, the full range of motion of those muscles. When we take a breath in, we want to feel those muscles be able to relax. When you breathe out and think about like tightening your core and lifting that pelvic floor, can you feel them lift? Do you feel that support happening? The reason that we want to restore this as one of the first things is that your pelvic floor is a part of your core. That is your center. That is your system when you breathe. It's working and moving all the time. So we want that foundation to be really, really strong. So when we go into exercise, we know what to be feeling for. We know what to be watching for. So we know, is this exercise too much? Am I ready for this exercise based on my control, my awareness, my coordination of my core and of my pelvic floor? Now, as you return to exercise, we want to watch for flags that the pelvic floor muscle coordination strength just isn't quite there. And maybe your symptoms are worsening with exercise. So things like incontinence, pain, heaviness, and pressure. Some of those things are completely normal early on in those first 6 weeks or so with healing. But if it's persistent and ongoing, especially as you get into exercise, that tells us, okay, these muscles are not quite doing what we want them to do. It should not be taken as, okay, 6 months down the road, I'm still having some leakage with things. It should not be taken as, well, I had a baby, that's just normal. No. We want to get ahead of that. Those are flags to watch out for, that something is off with the function of those pelvic floor muscles. So again, that pelvic floor health is the foundation for your entire system, that to get back to weightlifting, to get back to running, to get back to jumping, to just function daily, lifting your kids, lifting your baby, all of those things, your pelvic floor is involved because it's a part of your core and that moves with everything, that's involved in everything. So we want to really restore that pelvic floor function, and not just doing Kegels over and over. It's the overall health. How are those muscles coordinating with everything? Can they have that full range of motion? How's the timing with things? And are we running into those flags or those symptoms as we are trying to do, more and more activity? The second point, talking about gradual progression and mobility. So gradual progression, we'll kind of break that down first, is the, like graded approach, the slow progression or fast progression, but a progression of step by step, getting harder and harder, more load, more complicated, more complex movements to ultimately where you want to be. The load and the movements required for your workouts and what the capacity that you want to do. So let's just think about this, especially let's say you're a runner and you stop running month 3 of pregnancy, right? And you're not doing any of that impact all that time. And then you have your baby and all these changes have happened and all this happened to your pelvic floor during birth. And then 6 weeks goes by and maybe you've done nothing because of the doctor told you to, or fear, or you just like, we're just focusing on healing, whatever reason. And then 6 weeks comes and they say you're all clear and you go for a mile run. There is so much in between there of, I stopped running here and then all of a sudden I'm going to run again here. What was done in between? There are steps that now we have weakness in our single leg strength. We have weakness in our balance, or like our tolerance to impact. So if we just jump right in and we don't restore all of those mechanics that maybe we lost from our body changing, from hormones, from posture, and from stopping running, we might run into some of those flags. Or not even from a pelvic floor perspective, we're trying to prevent injury. So if anyone were to stop, pregnant or not, running and then go, 6 more months, 7 more months, 8 more months without running, and then all of a sudden go run 5 miles like they used to do, the chances of an injury, the chances of something happening go up, because what were we doing in between there? Now, maybe you're someone who was consistently strength training and weightlifting, and you kept your glute strength up, you kept your single leg strength up, you were doing all these unilateral movements, maybe you were doing other impact movements, and your body may be able to get back to running much sooner because you have all of that strength. But that is where we have to figure out, like, where's our starting point here? What's our strength like? What's our mobility like? And what is missing, or what is altered or weakened, or what has changed coordination wise that we need to address in order to get you back to doing those things again efficiently. Not always safely, where it's like you're automatically going to hurt yourself, but efficiently, and trying to prevent as many issues as we can down the road. So it's important to restore mobility, hip mobility, thoracic, spinal mobility, ankle mobility, foot strength, hamstring length, like all of those things where we need this good optimal position of muscles and length of muscles and our joints to tolerate the load and the movements that we're going to put them through. And then for strength, we may not be able to tolerate as much weight as we did before. We may not be able to do the movement the same as before because we have now a weakened core that we have to restore. So the gradual progression into those exercises is important, and figuring out kind of a baseline, a starting point, and then not rushing into where you were 9 months ago in terms of how much you were doing, how hard you were pushing. When we jump back in so soon at that 6-week all clear and we haven't restored those things, then we may have issues. We may have, maybe not right away. There's a lot of people who you would talk to that will say, oh, I got right back to exercise and I was fine. But that's an anecdotal story. That what does fine mean to them? And what does fine mean 5 years down the road? They could have some very, very poor postural habits and very poor habits that is not affecting them right now. But then they have their second child and their third child, or they have an injury that comes up, and now they start to come out. So it's not about what anyone else is doing, and everyone's timeline is going to be different. So it's not about bouncing back. We have to have patience, and some people may be getting back to their prior level sooner than you, and it's okay. We have to open our mind and expand our idea of a timeline getting back to exercise, or at least getting back to where we were before, because there's such a pressure on like getting back and like proving something, like, oh my gosh, we're so strong, women can do everything. And you can, but there are things that happen to your body. There are changes that happen, and it's okay to acknowledge those things. And you didn't fail because it took you 6 months to get back to, where you were before, or it took you a year to lift as heavy as you did before. There's so much that happened. There's so much that changed. There's, again, the genetic, hormonal, like other aspects besides just the physical capability of you and your strength that can make a difference on that healing timeline. So I don't want you to be afraid of exercise and movement and feel like you're super fragile and you can't do anything. But I want you to think about having patience and not having this like super strict deadline or timeline that there's no flexibility and you feel like you're failing if you don't get back at that certain point. Progress, okay? See those changes. Notice when those red flags come up as I should figure something out here. I should change something. I should see someone about this before things get worse. And then continue to push yourself. Maybe, you're at 8 weeks and you're like, I've done all these movements and I feel really good, but I don't know if I should get back to any like jumping. You may be in a very different place and you may have the capability to do that. So you may be doing things sooner than someone else, and you're not hurting yourself for doing those things. As long as you have those mechanics and the strength to do that, it's okay to try things, to push yourself, to challenge yourself, and then see what comes up. And we just don't ignore those signs that come up. We see what happens. Cool. Now we know where we're at. Maybe I need to take it down a notch, and then I'll eventually progress back to this. And the last point I want to talk about is breathing mechanics and core activation. This is probably one of the biggest things that I am retraining and restoring when I have clients come in at all stages of their postpartum journey. So there are changes that happen obviously in your posture during pregnancy, and that can alter your breathing mechanics. That can alter where you're taking a deep breath in. That can alter, just what you're used to feeling with that deep breath in. And afterwards, if we don't identify those things and know what our body's doing, like our bodies are smart. It's going to compensate and figure out, well, how do I take a breath in? I just need to breathe, right? Your body's going to figure it out, but it's not always the most optimal for a deep breath. A lot of people that I see take a deep breath in and their belly sucks up and in. And then when they exhale, their belly pushes out and we like send all this pressure down, which is actually the opposite of what we want to happen. And some people don't know that they're doing that. They don't know that they did it different before. It was just like somehow their body figured out this pattern and did it that way with a deep breath, but it's now creating dysfunction within their system. And the other piece is your core. Like your belly was stretched out. Those muscles are stretched out. So the connection to them, restoring strength and tensile, like the tissue strength, is important because, again, some of those things are altered. And if we don't build the awareness of how to properly activate our core, how to use all of our abdominal muscles, how to find, how to use them as a whole, how do they connect with our pelvic floor? Again, coming back to with the pelvic floor, that's your core, that's your foundation, and your breathing and your core matters in all that you want to get back to, in your weightlifting, in your running, in your jumping, in your just daily life. So we need to make those as efficient as possible and build as much strength as we can through that core so you have this good solid foundation with all of your movements. We need to learn, how does your core work when you're squatting? How does your core work when you're doing overhead presses? A lot of times we don't think about our abdominals and our core being involved when we do things like that, when we're not directly working our abs. So restoring 360 breathing, restoring mechanics to your pelvic floor, and building core strength, not just in sit-up crunch movements. Those are good. That's one direction we want to strengthen, but twisting and rotation and side bending, and not just focusing on those lower abs, those deep core, which is a nice buzzword on social media, everyone talking about deep core exercises, but like a lot of people don't know actually how to feel that or what they're supposed to be feeling when they do certain exercises. So having that guidance, having someone teach you how to do that and restoring that is important for that postpartum recovery so that you can have better posture, you have a great support system with your movements. So when you lift and turn and do all of these activities of taking care of a family or taking care of yourself or exercising, that core function is working really, really well and efficiently. And if you have any questions on how the heck to do this, I have plenty of resources that go over how to connect to your pelvic floor, how to feel your pelvic floor muscles. So comment below and I can send you some of those. So I really encourage you to practice engaging your core and practice those breathing mechanics in various positions and with various movements so your body gets really used to knowing and connecting, like, okay, this is how we're going to function. This is how we're going to work when we do these things, so that you can continue to use those concepts as you go through that gradual progression in exercise. So let's recap our 3 points. So return to fitness postpartum. I know maybe you came to this video looking for an exact do this exercise, and that's just not reality. It's more about instilling you with the confidence and empowering you with the education on how to progress and knowing when to seek further support and help and outsource to an expert to help you with this. But as a concept, the things we want to think about restoring after or postpartum getting back to fitness are restoring pelvic floor health and function, gradual progression back to exercise, not expecting us to go right back to where we were 9 months ago, but gradual progression and mobility, and then proper breathing mechanics and core activation. Really focusing on those foundations can help guide you and feel really confident getting back to your fitness routine postpartum. Again, this is a process, and pelvic floor physical therapists who really are versed in fitness and weightlifting and strength training and getting you back to whatever you want to be doing are a very helpful resource to help you do this and give you a customized program, help you make those decisions, when to move to the next movement, when to add more load, how does your form look, teaching you all of these concepts. That is why I recommend that every single person goes for an assessment so that we can lay out, this is the roadmap to get you there. This is how we're going to get you from here to here in the most efficient way possible. So I'd love if you leave any comments about experiences you've had or questions that you have about any of these concepts. And make sure you subscribe for more tips on pelvic health and fitness. My name is Dr. Logan Lynch, pelvic floor physical therapist, and I'll see you soon.